On behalf of the American Medical Association, I'd like to welcome you to today's webinar on healthcare advocacy and the new administration, which we've developed especially for medical students. I'm Todd Unger, the AMA's Chief Experience Officer, and over the next hour, we're going to look at the impact the Biden administration could have on the COVID-19 pandemic, healthcare policy at the national and state level, and a lot more. To address these topics and the questions you've submitted, we've lined up three terrific panelists who can speak to healthcare advocacy at every level. First, Todd Askew is the Senior Vice President of Advocacy at the AMA. Jenny Young is the Membership Director of the Medical Society of Virginia, and Riley Bieler is the AMA Government Relations Advocacy Fellow, or GRAF. Thanks to all of you for being here today. Why don't we just get started by hearing from each of our panelists about the unique perspective that they'll be bringing to our discussion. Todd, why don't you start?
Sure, thanks, Todd. So I'm Todd Askew, Senior Vice President for Advocacy at the AMA. In that role, what Advocacy at the AMA encompasses is not only government affairs and the Advocacy Resource Center, which supports the government affairs efforts of our state medical associations, but also federation relations, AMA's healthcare policy functions, and political affairs all fall under the advocacy. That includes grassroots as well. So all the different elements that we bring to our advocacy toolkit are kind of found within the division that I'm lucky enough to be able to head.
Great. And hello, I'm Jenny Young. I'm the Director of Membership at the Medical Society of Virginia. We are based in Richmond, Virginia. And as part of my role, I work with all of MSV's 10,000 members. And our members are comprised of physicians, physician assistants, residents, and then my favorite, medical students. And I've spent the last 9 years with the organization really working to make sure that we get medical students engaged in all aspects. And one area that's just been tremendous is getting students involved in our advocacy efforts. So I'm excited to share some of what we've done.
Good afternoon, all. I'm Riley Bieler. I am the AMA's Government Relations and Advocacy Fellow. So I am technically an AMA employee who works under Mr. Todd Askew here today. However, I'm also a third-year medical student at Elson S. Floyd College of Medicine in Washington State. So in terms of the advocacy space, I bring the medical student voice, policy priorities, and values to the table when we're discussing critical advocacy issues.
Well, thanks so much again to our panelists. And why don't we just dig right into the questions which were submitted by our audience. So first question's for Todd. What are your thoughts on the current health policy plan as it relates to efficacy, the political environment, and economic ramifications? And what do you think is feasible for the Biden-Harris administration to achieve in terms of long-lasting healthcare reform?
So thanks for the question. This is a sea shift in the approach that this administration is taking. Over the last 4 years, we have been kind of fighting a defensive battle, trying to keep things from being taken apart, taken down, to keep new restrictions being put into place. And now we have an opportunity not only to repair some of the damage that was done over the last few years, but to build back up and to make improvements in our healthcare system, particularly in the area of coverage. We have to remember that President Biden and Vice President Harris did not come to this as single payer advocates, as agents of just massive overhaul of the healthcare system. They see their mission primarily as focusing in on where are the gaps, where are the problems that we can fix, what are the adjustments that we can make, what have we learned over the last number of years in dealing with the Affordable Care Act to address those populations that have been left out or left behind. Part of that is the equity focus that they're bringing to all of their work, which is terrific because the COVID pandemic has just really laid bare the impact that some of these gaps in our healthcare system have on minoritized and marginalized populations. But also, what are the opportunities to make healthcare more affordable? Increased subsidization, greater access to subsidies for ACA plan purchases. Also, limiting the percent of your income. I think they proposed about 8.5%, would be the maximum you would pay in premiums to obtain good quality coverage under the Affordable Care Act. Perhaps even opening up the Affordable Care Act for purchase, not for subsidization necessarily, but for purchase to buy into it, even for undocumented persons in our country. So they have a whole menu of ideas. The biggest one I would mention, of course, that they have put on the table during the election is the public option. And while there is some ways that we believe a public option could be implemented in a fair way, there are also a lot of concerns that the AMA has on how the policy could be implemented, and some concerns particularly with the proposal they have laid out. I do think, though, that they're not going to jump into that right away. I think they're going to do the things that they know they can do first, and then kind of the more aspirational things they'll take more time and more focus on. So the whole world is open in terms of healthcare policy. I think we're going to see some substantial proposals and some substantial efforts to build on the system that we have, and it will be a great opportunity for us as an association, but also for physicians, for medical students to play a really positive role in impacting how those policies are implemented.
Todd, we've seen a flurry of activity over the last week in the healthcare space. Is there anything notable or things that stand out to you on that trajectory?
Well, I think the most important thing, obviously, is that they're just laser focused on the COVID epidemic and pouring resources, time, effort, attention into getting a handle on the pandemic. And it's not a light switch. It's not that the Biden administration is here, and so now we can just flip a switch and everything will be better. But they are calling out. They're being honest. They're being transparent about the challenges that we face. They're being open about the shortcomings, the difficulty of the path that we're going to have ahead for the next few months. And they have also said, I think it's refreshing to say, we are going to make mistakes. We are going to say things that we can't, that are not necessarily achievable, and we will admit that, and we will pull back, and we will explain ourselves and be honest. And so to me, that's the most refreshing thing. That's the most enlightening thing that's happened over this first week, is just their bluntness and the effort that they are pouring into it. And this is what it's going to take to get us there. It's going to take a lot more money. It's going to take a lot more time. It's going to take a lot more commitment. But that is where they have put their priority first and foremost. And so I think that's a great sign for the effort that they're going to put into not just COVID, but into healthcare policy as a whole.
Absolutely, and that makes a lot of sense. Well, Jenny, you and the MSV spend a lot of time and effort, obviously, on local and state level advocacy issues. Can you talk to our audience about the best ways for students to network with physicians or state societies to affect changes?
Sure, this is a great question. So the first and kind of key thing is, if you're not already connected to your state medical society, reach out to them. All 50 state medical societies have a website. Find it, go on it, and reach out to someone in the government relations or health policy teams, and just share your expertise and passion. One thing that we see on the state level a lot is a lot of the legislation that's discussed is around scope of practice. And medical students are so important to having those conversations. One thing I've learned, legislators know a lot of things. One thing that not all of them know about is medical education. They don't understand that, after you graduate medical school, you are a doctor, but you still have 3 to 8 years of intensive training before you're allowed to practice independently. And really going through, the first 2 years of medical school, you learn, all of this book work that is so critical, but then you also spend your second 2 years, touching patients in the hospital, doing rotations before you go into your residency. And just being able to share about your experiences and what you're learning and how that differs from other provider types or groups really just helps to make the conversation more robust.
Are
So
you
medical
finding,
student,
Jenny, do you
yeah,
find out are there other issues that you see a lot of interest from medical students in?
yeah. Another big thing is public health. Medical students, as we like to think, are the core of, the heart of medicine. And so we, in Virginia have been really focused on mental health care. We, have a big project in place that the students have been very involved in advocating for funding for about pediatric mental health care, and incorporating telemedicine and, making sure that children can get adequate care. And it's a topic that medical students love to talk about, obviously, because it's such a wonderful, pure, good thing. And legislators love hearing about it from students. And one of the things to answer the second part of the question about engaging with physicians, one thing that we do in Virginia that's just great is, you have access to some of the top, physician lobbyists out there through your state medical society. So really, reaching out to them and asking for advice, asking, how do you talk to a legislator, that may feel differently about a topic? And they've been there and done it on both the state and the national levels. So, reaching out to the physicians that serve on your delegation that come to the AMA, and just, see if you can get a Zoom session with them and have them give you their years of wisdom and advice as to how you can be the best, advocate for both the profession, but most importantly, your patients.
Absolutely. And I know you mentioned before the webinar that you are training a large group of students right now as
Yeah.
Virginia's legislature, as in legislative session right now. So there's great training ability there as well. Riley, you're a person that has really taken a big step in terms of your engagement and advocacy through your work with the AMA. Can you talk a little bit about how medical students play a role in advocacy and the most effective ways for medical students and residents to affect policy?
Absolutely. I was just thinking about what Jenny said related to lawmakers not knowing too much about medical education. And I laugh when people say, oh, well, physicians just go into this field for the money. And that is, any physician or medical student will laugh with you, because that's definitely not the case. We do this because we love our patients. We care about our communities. One of my favorite things that I've been able to do during my time as grad is go to the different medical schools virtually, of course, and talk to them about what it means to be an advocate and empower and give them the resources to do advocacy in their own communities. And students play a critical role in advocacy. We truly do serve as the future generation of physicians. And as Jenny and Todd both stated, lawmakers at the state and federal levels recognize this and want to hear from us. And I think it's really interesting. Before this webinar, I actually looked on Merriam-Webster about the definition of advocacy, and it's defined as support for or recommendation of particular cause or policy. And this is such a broad umbrella term. So advocacy to me is going to look different than advocacy to Todd or to Jenny and to many students in attendance. And what I think is so beautiful about our state medical associations and our national medical associations is that we all bring our own unique personal experiences, styles of communication, views of the world, problem-solving skills to the forefront of our careers, as well as the advocacy work that we do. And then these differences make our advocacy work so much stronger and allows us to look at issues from a whole bunch of different viewpoints and approach new upcoming issues that we're seeing with COVID-19, but also long-lasting issues related to healthcare accessibility, affordability, equitability, and quality in a way that hasn't been done before.
Riley, I'm curious, I'm sure you had certain expectations before you took the role of the graph. Now that you've been in this role, what's been the biggest thing that surprised you as you kind of see closer up advocacy efforts? What's been that biggest surprise for you?
I thought it was really going to be challenging in this virtual world, but I was really surprised and encouraged by the accessibility that being virtual gives us. I mean, we're allowed to reach out to lawmakers because we don't have to set up appointments to the office and travel. We're able to bridge some of these gaps in communications and see where some issues lie, particularly in our communities who suffer from minoritization and marginalization. And then, students can come together and coalesce and create these advocacy groups to try to fight for issues that we're passionate about. And I think, during the pandemic and during this really, I hate that word, but unprecedented times, we are seeing just a massive increase in advocacy efforts on all levels, and the role of physician, the role of medical student is completely transforming to where we're not just providing in-person physical care, but we're also addressing issues that people are dealing with at home in their communities related to, environmental, social, and all in between inequities. And I think although, it can be emotional and challenging, it's really encouraging to see medicine be so transformative.
Well, thank you so much. We're going to take the next round of questions, or questions from our attendees. Todd, you're going to get the first one here. I'll just read the question. As a medical student, one of my major concerns is the state of medical student debt. In 2019, the average debt at my school in particular was over $290,000. Are there plans for the administration to reduce the average indebtedness for students?
So it's a great question. It's not an infrequent question. I think I'm sure Jenny can test this, and I'm sure Riley can as well, that indebtedness is not only a concern for medical students, but it is a factor that can lead them to certain specialties and away from other certain areas, because quite frankly, just the burden that debt puts on them and forces some of these decisions. The administration has not specifically put forward anything right now, but during the campaign, they did talk about several proposals. I think the biggest problem we have with medical student debt is it gets lumped in with everybody else's debt, where someone may have, the vast majority of student borrowers are facing, $20,000 in debt, $40,000 in debt, that nobody faces the type of debt that students do. And unfortunately, solutions tend to be focused on, the broader community of students with debt than specific to medical students. So the administration has talked about simplifying this whole mishmash of programs and pathways there's now to a single income-based repayment pathway that would limit folks' payments each year to 5% of discretionary income, so after taxes, after certain expenses, and after 25 years, the remainder of the debt would be retired. That is more generous than the current income-based repayment programs. So that is something we'll obviously be taking a very close look at once they actually move to put it forward. A concerning one that I have is the public service loan forgiveness program proposal that they have put out, which is a great pathway for a lot of students to be able to serve in maybe lower earning areas, but see significant amounts of debt retired through public service loan forgiveness. The proposals that they have put forward essentially would cap total public service loan debt forgiveness at $50,000, as opposed to now, when after I think it's 10 years, the entire amount is forgiven. So that is not, to me at least, an attractive pathway for those with high debt burdens like medical students. So we'll be working very closely and looking very closely at what the administration proposes and how Congress moves on some of these, and making sure that we don't lose the unique situation that many medical students find themselves in the broader effort to address this important issue for all borrowers.
Thanks so much, Todd. This next question is for Jenny. As a medical student in a red state, my opinions are often dismissed when I contact my congressmen and women regarding the importance of improved access to healthcare. What are strategies or advice you would give to speaking to representatives who have an opposition to what you're advocating for? Beyond the moral obligation that I should draw all support to this cause, how do I convince my representatives of the fiscal benefits of funding primary and preventative care?
Yeah, and this can be a really tough thing when you're going to talk to a legislator that off the bat is not going to agree with, what you're saying based on their previous voting record or comments. And the first thing I'll say, just kind of overall, one thing is, if you're talking to them and they start kind of arguing with you, do not argue with them back. And that's kind of a basic thing. But in terms of kind of preparing yourself for the conversation, prepare yourself for, this difficult conversation, as you would say, a difficult conversation you would have with a patient. Come to that room, come to that table with all of the data and facts that you can. So in terms of, Medicaid expansion, which is a big thing that's been a discussion, especially for some of the red states, there is an enormous amount of data out there that shows, certain red states that have expanded Medicaid, such as Louisiana or Arkansas or Kentucky, the positive fiscal impacts that the Medicaid expansion has caused. So the Commonwealth Fund, is a place that does incredible data analysis work. And they actually found that from 2014 to 2017, Medicaid expansion was associated with anywhere from 4.4% to 4.7% reduction in state spending versus a traditional Medicaid spend for a state. So I think really going in and arming yourself with those facts and statistics help to make it a more objective conversation versus kind of some of the emotional and social issue type conversations, which rarely go in your favor when talking about things such as this.
I think that's really great advice, Jenny. This last question for Riley. The COVID-19 pandemic has reaffirmed the inadequacies of our current healthcare system. How does the current situation demonstrate the need for a universal healthcare system in order to address the inequities that we're observing today? And what do you believe will be done differently to better address low-income patients' healthcare needs and social determinants of health?
The person who wrote this question is completely correct. And I think there's multifaceted problems with this. And I think this requires a multifaceted, well-informed solution. So I'm going to try to provide that today. So COVID-19 has exemplified the deep-rooted inequities that already exist within our system. We see it, it's been persistent, but it's just further exacerbated what we already know that exists. In particular, we have observed systematic institutionalized racism and historically discriminatory policies that have directly and indirectly harmed marginalized and minoritized communities. We continue to see those in tribal, rural, and lower income communities have limited or more limited access to COVID-19 testing, vaccine availability. And this is reflective of the wider spread inequities that exist in our healthcare infrastructure. And that really sounds negative, but there is a positive light. We at the AMA, we believe that all of our patients should be advocated for, and that includes access to affordable, high quality, ethical, and equitable healthcare and public health services. Now, to approach the issue related to access to care, like Todd and Jenny said, it will take a multifaceted solution, which it'll incorporate feedback from all stakeholders, policymakers, healthcare professionals, and the leaders who exist in these communities. And colleagues, I'm not going to lie, advocacy is really hard sometimes, and we are facing incredibly difficult times. And we will continue to face challenges surrounding COVID-19, as well as the existing issues surrounding medical financing in our future practice. However, we have a voice, and that is what this conference is all about. That's what this webinar is about, the medical student input. That is so critical because we are going to be the leaders, the policy leaders, the medical professionals who face these issues in the future. And so we can continue advocacy now in your state medical associations and AMA, for Congress and the Biden administration to have discussions about expanding Medicaid access, improving, coverage and reimbursement for Medicaid providers, building upon the ACA. And as Todd said, they brought in potential conversations surrounding potential public option. And due to recent policy that we adopted in November 2020 at our last meeting, we have the opportunity to be able to communicate and participate in conversations, surrounding the creation of a potential public policy. And now to address the second part, because this is, a multifaceted question, and what I think is the most important part is we are beginning a new change on what it means to be in medicine, what it means to be a physician. So addressing health, like I said earlier, doesn't just mean addressing the physical well-being in office. It means looking out inside to our patients' emotional, social, economic, environmental, and whole being that exists inside your medical office and outside. And so, COVID-19 has only further inflated the stark disparities that exist between communities. Indigenous communities, Latinx, Black communities, they've suffered the greatest rates of morbidity and mortality secondary to the pandemic. But not only that, they've also suffered from the economic consequences due to the nationwide shutdown. And Black persons are most likely to, or more likely to be living with chronic medical conditions that place them at high risk for severe cases of COVID-19, which is, reflective of those historically discriminatory policies that exist in all of our infrastructure. But I know this is turning really negative, but it shows that we can do better. So it's critical that we as an organization, and just yesterday, Dr. Bailey released a statement supporting the Biden administration's anti-racist policies, and we can continue to promote anti-racist health policies and legislation centering health equity. So our short-term policies and approaches will need to be bolstered by policies that support social and economic flourishing in minority communities, as well as interventions to prove things such as access to education, healthcare, and the ongoing discrimination, labor, housing, and the justice system. And so in the clinical setting, we can begin by integrating assessment of social needs for all of our patients, supporting the integration of training and community-based partnerships to address social determinants of health that I believe comprise about 70% of our patients' health, and as well as creating a structural humility environment to assure that all members of our medical team are prepared to serve our patients with high quality, safe, and patient-centered care. I know that was a mouthful.
Well, thank you so much, Riley. I do want to touch base on a little bit more about just the aspect of policy. Todd, why don't you start by, talking. I think there may be students out there that are not thinking, I can have, real impact on healthcare policy. So can you talk about the most effective ways for students and residents to affect policy?
So first of all, let me put a pitch in here for the National Advocacy Conference, which is coming up in a few weeks. It's a great opportunity in this virtual world for people who may not have been able to participate before in conferences, in this conference or one similar to it. There's going to be a lot of training associated with, it's not just going to be members of Congress speaking about their priorities and policies, but there's going to be some real grassroots training, some real how-to advocacy 101 type session. So I would encourage people to look into that and participate if they are able. I would also say that, as medical students, well, let me say two things. This is the time to begin your career as an advocate for your patients, not just their caregiver in the exam room, but kind of an advocate for their health and the health of the nation, and make that part of your regular practice throughout your career. And there's no better time to start than that. And it's not just kind of an option; it's really an obligation you have to provide for the needs of your patients in all ways. And so you have to bring to it that conviction that this is what you're supposed to be doing. This is not like, I hope they will listen to me. This is your job to speak out on behalf of your patients and to make that part of your regular practice. And so you can't be intimidated. You can't be put off. Look, there are people that won't listen to us, and that's just the way of life. But they're never going to hear you if you don't try to speak to them. And so just jump in. You will find audiences that are more receptive and less receptive. You will learn techniques through experience, through doing, about how to craft your message so that it is heard by people who may have different views than you. Jenny mentioned bringing data. There's data out there. There are resources out there that we are here. The Medical Society of Virginia is there. Your specialty societies are there to provide you those resources to help and support you in your advocacy efforts. And so the way to do it is just to do it. Is just to begin, one foot in front of the other and start making this a part of your day-to-day being.
That is just excellent advice. And if you want to find out more about the National Advocacy Conference that Todd mentioned, you can find that on the AMA site. Jenny, Todd talks about getting started right now as a student. It's probably it's challenging right now during the pandemic, and especially exhausting. What are some of the ways that you would recommend that students best care for themselves and support each other during a time like this?
Yeah, that's a great question and something I think we all need to be asking ourselves. One thing after hearing Riley and Todd talk about all of the, great work that's been done, as well as all of the work that's still yet to be done, um, it can be really overwhelming. And, you actually are, by being a member of the AMA and being a member of your state medical society, already taking part and are part of the solution to really addressing some of these concerns, because your membership helps to support, Todd's team and the great work that the AMA is doing. So, you can definitely go to bed tonight knowing that you, by being a member of the AMA, are helping to affect change in healthcare. Um, but in terms of the more, just day to day, one thing that we're really focused on at the Medical Society of Virginia is, the extensive amount of burnout and, depression that has come due to the COVID pandemic. And we've been working on, a program that we're really proud of called Safe Haven. And it really is, about removing the barriers for physicians and medical students and nurses and pharmacists to seek care, and being able to talk to someone, whether it be a peer coach or a counselor. And we, are working with states all over the country to, bring this program to them. But, it is something that's so basic as, talk to your lab partner, talk to the people that, are in your anatomy group, and, just check in and say, how you doing? If it's a nice day outside, go for a walk. I think all of us live on Zoom all of the time and forget that fresh air is so important. And just make sure that you're taking care of yourself, because you can only be as good of a physician and clinician as you come, and you are. So making yourself healthy and whole is the first step.
Thank you so much, Jenny. Well, last questions for you, Riley. We talked a lot about, making a difference through policy, but what can you tell medical students about contributing in, productive advocacy-based ways through clinic and research? How do we find COVID-related research to work on?
Definitely. And I just want to reiterate everything that Todd and Jenny said. It's so important that we start now as medical students and build our advocacy skill book as we go along through the medical education process. And, you don't have to be a policy analyst or a lobbyist or go to school for public or political affairs to do advocacy. You can do advocacy in any field that you go into. And I personally think that some of the first ways to do it is find a mentor. I can't tell you how overwhelming it was at first, just being a medical student, wanting to be in advocacy and don't know where to start. And so, like Jenny said, I started joining my local and state medical associations and getting connected with physicians who do advocacy and seeing if any members are interested in the same issues that I'm interested in, and then learning from them and being able to participate in some of their actions to learn from all of the progress that they've made, but also maybe some of the things that didn't go so well. And so in terms of clinic and research, again, I think you can center advocacy with your clinic, with a clinical practice, as well as with any research that you do. For example, fighting, racial essentialism medicine, ensuring equitable representation in your research subjects, taking a look at things from an equity-centered lens and seeing how your research or the things that you're doing may impact or may cause consequences for multiple different types of populations, because, multiple populations receive consequences differently and are suffered from different aspects of medicine and public health that are unfairly distributed. And in terms of finding COVID-related research to work on, Something that people don't do nowadays, but worked for me, worked well, is cold emailing. Email people and call people that are interested or working on things that you want to be a part of. I can't tell you how much in our medical associations and just medicine in general that physicians really want to give back and teach the next generation. And it also doesn't have to be limited to medicine. We promote collaboration. Look at what's being done at PhD programs, at public health, social science institutes. Really build that team coalition to approach COVID maybe from different ways, or to approach advocacy from an alternative viewpoint.
Well, thank you so much, Riley. That reminded me when you were talking about research, we just had the AMA Research Challenge a couple of weeks ago, and one of the co-winners did research on, how do you ensure equitable distribution of respirators in the COVID-19 pandemic? And that's the kind of thing where you can build in a topic of advocacy and equity into a lot of different research topics, especially now. Well, that's it for today's discussion. I do want to thank all our panelists for joining us here today. Todd, Jenny, Riley, really appreciate you being here and giving your advice to our audience out there. I also want to thank all the medical students who tuned in today. You do represent the future of medicine, and it needs your voice and your drive and your innovative thinking right now more than ever. Our discussion today is just the beginning. If you want to learn how to be a successful healthcare advocate, I encourage you to become a member of the AMA and register for the Medical Student Advocacy Conference that's happening on March 4th and 5th. In this one-of-a-kind virtual conference, you're going to learn effective lobbying techniques, find out about current legislation impacting students, and even connect with your local representatives and senators. If you want to find out more about that, visit ama-assn.org/med-student-voices to learn more and register today. Again, thanks so much for joining us today. I hope you enjoyed the discussion, and I hope you will take this as an impetus to get involved in advocacy issues right now for medicine. Thanks again.